Meanwhile, Axios is reporting that more than a dozen GOP senators were invited to attend an emergency session last night to hash out their differences on the Republican health care plan. Joining us now, one of the lawmakers who attended the meeting, South Dakota Senator Mike Rounds. Senator, good to see you again. Thanks so much for joining us.
Thanks. Appreciate the opportunity.
Can you walk us through that meeting?
Well, there were probably more than 25 of us that actually attended. It was a good meeting. We worked through a number of issues. Our goal is to get to 50, but also to make it an even better bill. Right now, it'll reduce prices by 2020 by over 30% in the individual market, and we're going to return a lot of the power back to the states. That'll be a step in the right direction. More local control, give governors the opportunity and local legislators the opportunity to make changes in health care based upon what their needs are.
So is there any chance that you could actually get the bill to the floor for a vote in the next couple of weeks?
I think so. I also think that as we do it, our goal once again is to provide more local control. I think we're getting there. Last night I think we had some very productive discussions. We're not completed yet, but there's a lot of real sincere people working on it. I felt very good at the end of the meeting. Not done yet, but most certainly getting there. And once again, we've really got a lot of people across the entire country with different concerns, and we have to take those all into account.
I think, Senator, it's called their different self-interest is the way that the American people feel about it. But so you think...
I'm gonna call back on that a little bit. In this case, we have individuals that are concerned about what's going on within their states. These are real people that get hurt, and that's the message that's out there. There is a lot of emotion, and the emotion isn't about re-election. The emotion is about whether or not we're helping or hurting long-term health care in the country.
But, Senator,
those types of feelings are pretty strong.
When you use language like the word hurt, which Shelley Moore Capito used in her statement that she put out, I didn't come to Washington to hurt people, you are using the language and the lingo and the messaging of the Democratic Party.
No, I think with Republicans, we care about people long-term, not just short-term. It's kind of like, do you give somebody something or do you help them achieve for themselves? The same way in health care, people want to make decisions, but they want to have the ability to not only make the decisions but be able to afford them. ObamaCare drove health care prices up. We're trying to bring them back down so that normal people can actually afford to buy health care again and make those decisions for their family. People are scared out there right now, and they're afraid because of what ObamaCare has done to the market, because of what has happened with ObamaCare and the number of people right now that can't even find a place to buy insurance. And if they can buy insurance, they've got deductibles that they can't even afford to pay. These are real people that work hard who are concerned about how they're going to take care of their families. That's the message that we've got out there, and I think we're moving in the right direction.
You're absolutely right. So why are you keeping in your bill to Obamacare taxes? You know, we talked about this the last time you were with us, and we're all just sort of, scratching our heads wondering why you would keep in the investment tax, 3.8%, the payroll tax. We spoke with Congressman Jim Jordan earlier in the program, and he said, forget about the border adjustment tax, forget about revenue neutral. Here's what he had to say. What's your reaction? Listen to this, sir.
This idea that it's going to be revenue neutral, we're opposed to that. Many of us conservatives, we think that's just a fancy way of saying that the tax burden stays the same. You just shift around who pays what. And under that scenario, we know what happens. The connected class in Washington always gets a good deal, but middle-class families get a bad deal. So we want to have more specificity on what's in the tax proposal. We're all for tax reform and lowering the tax burden on families and creating a tax code that's conducive to economic growth. But we don't want this border adjustment tax, which is a whole new tax put on the American economy. We don't want that in the plan. So show us the plan, then we'll pass the budget if we're actually achieving the savings we need to and putting together the right kind of tax plan.
Well, and you say what?
I say on the border adjustment tax, it's dead. It's not going anyplace. We want to see tax reform as well. There's two different bills that would have to be used to do it. Reconciliation would be used to make changes, but it has to be revenue neutral in that respect. A second bill can be done that would reduce taxes. We're all in favor of that. But when it comes to health care, we have a transition period in which we get over this Obamacare hangover. And if we don't help working families with those premiums and with those costs, they're going to bear the entire burden themselves. Republicans are not going to do that to the working poor in this country and to people that go in and work hard every day and expect that we're going to help them get through this very, very tough transition. That's our goal, and that's what we're going to use those taxes on people with incomes over $250,000 in their household. Most of those individuals that receive the benefits from this are people that have no place else to go. ObamaCare was not their idea. This was dumped on them.
Yeah.
They're trying to survive it, and we're going to do everything we can to help them.
Dagan, what do you say to that?
Senator, Medicaid, before it was expanded under Obamacare, took care of the poor. And the fact that you are pouring more money, you're raising taxes on people and standing by an Obamacare tax increase, that I think that it gives you very shaky ground to stand on when you go to actually reform taxes.
I think actually to begin with, we're not raising taxes on anybody. There are some provisions that were built into it that are there. We're going to leave some of them in place right now. We're not going to be reducing the taxes, but the revenues that we're getting from them are paying for a transition out of a very expensive Obamacare model. If we don't do that, would you prefer to see those costs borne by people that have no place to go to pick up thousands of dollars in insurance premiums per year? I don't think Republicans in the Senate are going to do that to the American public. These are folks that trust that we're going to get them through a tough time. They want us to be reasonable. They want us to be practical and pragmatic. Simply looking at it saying we're going to cut a tax for the sake of cutting a tax, and the heck with the American public who can't afford to pay their health care premiums, the heck with the people that are suffering with Obamacare, we'll just let them suffer. We're not going to do that. We're going to fix this thing. We're going to get them through the tough time. We're going to transition out of Obamacare and into a product that allows more local control, more opportunities for lower premiums. But at the same time, we're going to get this away from a central provider. We're going to get this back to where the states control more of the resources and more of the decision-making, and let patients actually make some of the decisions themselves.
Senator,
again.
we're all thinking about John McCain this morning, and I know you are as well. Thoughts, real quick?
Last night, we said a prayer for John as soon as we found out. He is truly an American hero. If there's anybody that can beat this, it's John McCain. Our prayers are with him. We want him back. The Senate is not the same without him. He works across the aisle. He is the real deal. Last night, Lindsay had him on the phone while we were all in the room, and he was telling us what he was going to do and what he wasn't going to do with regard to health care, and he'll be back. He'll be back because he cares, he wants to be involved, and he understands that he's a huge part of the United States Senate.
All right,
we wish him the best.
We will leave it there. Senator, good to see you, sir. Thank you.